I'm Abdullah Ibrahim Sanko, and a state registered nurse and also a public health officer, and currently a student reading BSc Honors in nursing. And I happen to be the founder of Sustainable Humanity and Advocacy for Sickle Cell, and I'm a sickle cell warrior.
Okay, sickle cell disease itself is a blood disorder where you inherit it from. There are two types: sickle cell trait and sickle cell anemia. So if you have both genes, the two genes which are recessive, both of them are present in you, then you have sickle cell anemia. If you have one of the genes and one of the genes is normal, then you'll have sickle cell what? Trait.
If your partner also is a sickle cell patient, also there's possibility for the child to get it. But if the partner is not, then you can only have a child that is having trait, which means that child is also having the risk of not getting somebody who is a sickle cell trait, also sickle cell person, for them to come together and produce the full-blown also.
Sickle cell disease makes it impossible for the blood vessels to carry blood to the right vessels at the right amount, because the blood vessels are sickle in shape instead of being biconcave. So there's this struggle within the body. So you have to have eat food that are nutritious enough that will be able to help you in pumping blood around your blood vessels and everything.
What we rely on more, the clinical presentation. Many a times they will present with severe bone pain. They will have difficulty breathing and, this acute chest syndrome, vaso-occlusive crises. You can see some jaundice in them, anemia, hemolytic crisis, aplastic crisis. All these are manifestations that do occur.
We have what we say sickle cell in pregnancy. And for those, although there are not many, but we have them once in a while, women who are sickle cell and they are pregnant. And we know their attack is very painful.
Sickle cell pain treatment is different from any other pain. Reason being, one, you have to look at what is causing the pain. Then, if you have noticed what is causing the pain, then you will target treating the pain, and also the key way of treating is what is causing the pain. If you see the patient is having malaria or typhoid, target the typhoid and the malaria. By dropping down the typhoid and the malaria, then treating the pain will be very simple for you. But if only you target the pain and you forget about treating what is causing the problem, it becomes worsened.
If malaria attack us, definitely the sickle cell will go into the crisis will come, and it will come at a very excruciating level. The pain will be so much if the malaria first attacked you before the sickle cell crisis came. So it was lack of proper medical attention that leads me to a hip replacement surgery problem. And I was diagnosed of a vascular necrosis of the left femoral head. That's why I'm using this crutch to prevent limping too much.
Because it's a chronic illness also, when it comes to managing these cases, for me, I don't know of any NGO in the province that supports the treatment of sickle cell disease patients. You see, and for the confirmation test, we don't have the machines there to confirm it in the province. Many a times, if you want to really confirm the sickling, you may need to send to Freetown, the capital city of Sierra Leone.
when they are pregnant, also there is possibility of us losing that baby during the pregnancy also. And so those are high risk, we think. But also when they are also delivered and they survive the pregnancy and then they are delivered, there is also possibility to lose those kids at the earlier stage also, because they are not doing routine tests for all newborns. You may not be able to know that this is what is happening with them. And we all know children usually don't complain, they just cry. So we find out that one of the key areas is even those pregnant women that are having sickle cell also, when they are pregnant, there is a lot that need to be done for them to keep them stable in order to save even the unborn baby. There's possibility we can have stillbirth, because of their blood are not too normal, their blood cells are not too normal. So they are fast to be anemic. And so when they are anemic, we know some of the conditions, that's how they present also.
Our community people most times mismanage them because you see them tying them, some of them placing stones on them, thinking that will ease the pain. And for us as a health facility, we are not delivering them here. They are always referred to the referral hospital.
And many of them cannot afford what it takes to treat them. They might require blood transfusion. If they don't have a donor, you have to pay somebody else who is going to donate for you. You understand? You might need some analgesics, some IV fluids to stabilize you. You may also need some antibiotics that are given as prophylaxis sometimes. And there are patients who are required some medications like the hydroxyurea, which are not readily available here in this part of the world.
If you have money to go to the hospital, the doctors there, they won't look at you. So if your mother or your family member won't have money, when you do that, the way you go there is the way that you will return home. They will not even see you, they will not even check you. Nothing will happen unless you give them money.
When they are not tested, it's difficult for people to detect that, okay, I have it. They will just complain, maybe based on your complaints, signs and symptoms that you are feeling, that people will be able to screen and say that, okay, because of sickle cell, you are having A, B, and C. But as I said, much is not done.
So the plan was to take me to Freetown, to Ghana Hospital, but within the arrangement, they said, no, let's try another hospital in Makilun. We went into another hospital, which is also a renowned hospital. Upon reaching that hospital, I was denied admission because I was in severe distress. I was getting severe difficulty in breathing. So I was denied admission automatically. Then my family members, my mother, my father, everybody was crying. The only person that was strong for me was my brother. And my brother said, no, I will not give up. Everybody said, okay, let's take this man to our house. Let's not waste money again on him, because any hospital we go will not get what we want. My brother said, no, he will not die, he will survive.
When you walk around the street on Fridays, you see a lot of disabled walking around begging, because it's not their making. It's because maybe when they are growing up, they were abandoned and not treated as normal human beings, wherein I can get them to learn something that they can do, trade or other things, and take care of themselves when they grow up. But they will feel that, okay, these people cannot do anything, and so they are abandoned. So when they grow, you don't have people to take care of them, and this is the only way they can able to survive, to ask people to support them, because they don't have something that they have been trained to do.
We too are human beings. We are not lazy people as they think that We are not lazy. And we too have our needs. We need a very good medical attention. Yeah.
These people suffering from sickle cell are suffering silently. Nobody cares. Nobody even think this specific set of people are there suffering. I'm calling on everyone, parents, neighbors, stakeholders, government, NGOs, to know that sickle cell, it's not just a disease, but it's something all of us should know that we should break the chain before it will take the population of Sierra Leone.